Congratulations on the birth of your new baby. Here are a few points that will be helpful for you to know in terms of what to expect from your newborn once you get home. Breathing. Newborn babies don't breathe with regular patterns as older children and adults do. Your baby may breathe in clusters. Sometimes they may sound like they're panting very quickly, and other times they are breathing deeply and slowly. This may feel and sound scary, but it's normal. The panting sounds should not last for more than 10 minutes. Babies' breathing will regulate as they mature and their nervous system develops. If your baby is grunting and has flaring nostrils, or looks like the skin at the base of their necks or around their ribs pulls in with each breath, you should page your midwife for further assessment. Color. A newborn baby's color should be well perfused with oxygen throughout their head and trunk. This means that they should have good color in the main part of their body. It's okay if your baby's hands and feet are a little blue or have a purple or gray tinged look to them. This is because the extremities, hands and feet, are getting the last of the oxygenated blood. A baby is concerned with survival, and all the major organs that they need to survive are in the brain and the main body. There are no vital organs in the hands and the feet, so they get the last of the oxygenated blood. However, if your baby's lips or face become blue or gray, call 911 immediately and contact your midwife. Babies also may get mildly jaundiced in the face until their feeding has been established and they are getting regular feeds and having regular stools and pees. Jaundice within the first 24 hours of life, or that goes down the neck into the baby's chest, is not normal and should be discussed with your midwife for further assessment. Babies are not very good at regulating their own temperature, especially in the early days and weeks when feeding is being established. Your newborn should be in one more layer of clothing than you are comfortable wearing at home, and their temperature should be between 36.5 and 37.5 degrees Celsius. Please invest in an axillary baby thermometer, which means it goes under the armpit. Ears and forehead models are not accurate for newborns. You can get them from your local pharmacy. It will save you endless hours of guessing and worry. If you have taken your baby's temperature and it is above 37.5 degrees Celsius, take off one layer of clothing and allow the baby to cool off, and then retake the temperature in 30 minutes. If their temperature is below 36.5, put the baby skin to skin with the parent and cover both with a blanket to warm the baby up and regulate their temperature. If, after trying these strategies, your baby's temperature does not stabilize to within the normal range within 30 minutes, or if it's ever above 38.0 degrees Celsius, please page your midwife for further assessment. Feeding. For the first 24 hours after birth, your baby will be recuperating from being born, just as you'll be recuperating from birthing. They will sleep most of the time, up to 5 hours at a stretch, and then need to be fed when they're awake. After the first 24 hours, your baby should eat every 2 to 4 hours, or 8 to 12 feeds a day. If you choose to nurse your baby, a typical feed can take anywhere from 20 to 45 minutes. To encourage equal milk production, you should aim to feed on both sides at every feed until your milk has been established. Babies will require about a half an ounce or 10 to 15 milliliters of feed on day 1, 15 to 20 milliliters or about an ounce on day 2, and up to 60 milliliters or 1 to 2 ounces by day 7. After day 7, which is 1 week, to about a month, they will eat anywhere from 4 to 5 ounces. Whether you nurse or bottle feed your baby, skin to skin at feeding time encourages the bond between you both and has health benefits to both of you. Behavior. Your baby will sleep most of their days away in the beginning, waking mainly just for food. There can be many different states of sleep, from one deep 4 to 6 hour sleep in a 24-hour period to 20-minute cat naps. Always put your baby to sleep on his back with nothing blocking the airflow around him. When awake, he may seem drowsy, quiet and alert, active and alert, or crying. All of these are normal. A baby's stomach is small, so feeding is required frequently, every 2 to 4 hours. If your baby is sleeping longer than 4 to 6 hours in the first week of life, wake him up to eat by changing his diaper or wiping a cool cloth on his face. If your baby is hard to wake or seems uninterested in feeding, you should let your midwife know. Diapers. Wet diapers are an excellent indication that your baby is getting food when they feed. A newborn baby should have a minimum of wet or soiled diapers equal to their number of days of life, up to 7 days. So you can expect 1 wet soiled diaper on day 1, 2 diapers on day 2, and so on up to day 7. In the first 24 hours after birth, you should expect 1 pee and 1 poo from your newborn. If you don't see this, please page your midwife. After the first week, you will not need to make note of the number of diapers anymore because there will be so many. Baby's first stools will be black or dark green and the consistency of tar. This is called meconium and will transition to a Dijon mustard colored seedy, liquidy stools once effective nursing has been established. Formula-fed babies will have stools that are darker in color and more firm. They also may have less frequent but bigger stools than breastfed babies. You may see urate crystals, which is a pinky orange dust-like substance, in your baby's diaper in the first few days after birth. This is normal as feeding becomes established, but you should not expect this past day 3. If you see it past day 3, please let your midwife know. Finally, baby girls may have a small bloody discharge from their vaginas in their diapers. This is also normal as it is a response to the withdrawal from their mother's hormones. Muscle tone. Although all newborns need to be supported when held, your baby should always have good muscle tone and be well flexed, not ever limp or listless. If they are exhibiting decreased or decreasing muscle tone or listlessness and cannot be roused, even for feeds, you should contact your midwife. The umbilical cord. Your baby's umbilical cord requires very little care from you. It will naturally fall off anytime within the first 14 days. In that time, it may be gooey looking at the base, it may discharge a small amount of old, dry blood, and it may also get quite stinky as it dries up. You don't need to wash it in any special way or apply any ointments or rubbing alcohol to the area. You should avoid manipulating it too much and try to avoid overwetting it when cleaning or bathing your baby. If it does get wet when cleaning the baby, just leave it open to air dry. If the area around your baby's umbilical cord on the stomach looks red or inflamed, let your midwife know. Finally, these are situations when you should contact your midwife. Aside from the examples that I've already given you, you should contact your midwife if your baby has an incessant and high-pitched cry that cannot be resolved and comforted, your baby has repeated and forceful vomiting, your baby is irritable and cannot be soothed with feeding, skin to skin, or a diaper change, or if you have any other concern about your baby that's not listed here. Thank you and congratulations.